Well, we made it. Today was the last day of ICD iCAMP at the World Health Organization in Geneva, Switzerland. The primary focus of today was to gather reflective feedback and to tie up all of the loose ends of the last 2 weeks of meetings. This morning, each of our iCampers had the opportunity to have 10 or 15 minutes to provide comment on the iCAMP, the iCAT, and the entire ICD revision process thus far. We heard the good, and we heard the bad. Our participants were critical, but constructive.
Some of the key benefits that have been achieved through the iCAMP has been both familiarisation with the tool and being able to provide critique of that tool. It's highlighted several issues within the content model that actually needed much higher level feedback and negotiation to clarify.
There are many challenging issues to do with how we'll resource this and how we'll achieve it, how we'll design the appropriate ways of bringing in the community.
Some of the challenges that are ahead with building this infrastructure is that this is a massive project. It has not been done before, something of this scale where you involve a hierarchy of editors and also the content experts in building the ICD, but at the same time allow other people to contribute to the authoring of this classification. That's a big challenge. So we need to look at how do we support the different needs at many different layers, and that's going to require also quite a lot of resources.
Many of the comments that we heard can be summarized in a few large themes. First, there have always been many ways to see and use the ICD, and ICD 11 will allow for that multi-dimensional, multi-axial usage.
The iCAT tool that's been developed to produce the ICD 11 is, I think, a major step forward for the development of a classification that's fit for purpose in a modern world, a world where people expect much more sophistication in the content and much more sophistication in the ways they're able to use the content. And without this software, I don't think it's possible to build the kind of classification that we need and the community needs.
Next, this iCAMP has allowed us to harmonize and unify the process for modeling and the need for constant update.
During this iCAMP process, we have the chance to really meet our users and talk to the different tag members, talk to the classification experts, and learn from them exactly the kind of the information content that they need to put into the ICD. And so we need to design the information model that can satisfy their requirements. Going home with a much better idea about what kind of the information and classification that are needed in this process.
And last, all of our participants were pleased with the energy and synergy of the group, as well as the ability of so many individuals from such a diversity of backgrounds to come together, to work efficiently, and to agree on much of the process needed for future work.
I've actually been energized by my colleagues because it's very rare that all of us are able to get together and bring together a body of knowledge. Each country that has sent a representative. We've all basically worked within our own national countries, and it is so good to be able to have the synergy at an international level and to build upon everything that we have done collectively now.
The iCAMP has actually been quite a lot of fun, and the interaction within the group is extremely positive. You have a lot of world-leading experts here who are all ego-free and are totally happy to just engage in the process and try and get the most positive outcome.
Several of the participants arrived last week with questions and doubts about the process, the timelines, and the transition to the iCAT platform. As they are leaving, however, they have a better understanding of the size and the scope of the project.
I have on my portfolio now a very good plan, a very good vision, and a very good preliminary work example that I can show to the foundations or donors or other stakeholders. I will try to get the funding that goes with it. Okay. Great. Now that you have the commitment, I think we will make it happen, and we have something to show to them that comes to teeth. Okay, It's not a dream vision which is vaporware. I think we have done a great job. I've learned many things from you, and we will do much better in the future. Thank you very much again. Bye-bye.
We are realistically optimistic that this work is possible, and we are excited for what ICD-11 can accomplish. Remember, if you are interested in getting involved in this project, you can find us under WHO ICD-11 Revision on YouTube, Twitter, and Facebook. You can also find us on the WHO website on classifications. Thank you for joining us for ICD iCAMP, and we hope that you will stay involved.